Hello and welcome. If you're a practicing clinician getting ready for flu season, or maybe you're prepping for your specialty exams, this is for you. We're going to break down the UK's influenza vaccination guidelines into a clear, practical guide. So let's jump right in.
First things first, all the information we're about to cover is based on the material and expertise provided by Dr. Mohammed Al-Nagi Mohammed, so you know you're getting clinically accurate and relevant content.
All right, let's start with a really common clinical scenario. Imagine your next two patients are a 4-year-old and a 70-year-old. They both need their annual flu vaccine. The question is, are you completely sure about the very different ways you need to approach them? Because, as we're about to find out, their vaccination protocols are fundamentally different.
So here's how we're going to tackle this. First, we'll set the scene and talk about the annual challenge of seasonal flu. Then, and this is the big one, we'll cover the core difference between the two vaccines. From there, we'll dive deep into the pediatric and adult pathways separately, and we'll wrap up with some key clinical pearls that you can use every day.
Okay, Section 1. Let's talk about the annual challenge of seasonal flu. This is really about understanding the why behind these guidelines.
You know, to really get a grip on the current system, you have to look back a bit. Before 2013, the flu jab was pretty much just for the elderly and other at-risk groups. But then 2013 happened, and the NHS rolled out a brand new program just for kids. That single decision is why we now have two completely separate strategies running side by side. It's why knowing the difference isn't just helpful, it's essential.
And what exactly are we up against? Well, the influenza virus has three main types, A, B, and C. It's types A and B that cause most of the trouble we see clinically. The flu season usually gets going around mid-November. So for us, that means the clock is ticking. The recommended window to get our patients vaccinated is between September and early November. We've got to get them protected before the virus really starts to spread.
All right, let's get to the heart of it in Section 2. Honestly, this is probably the most important concept we're going to cover, the huge difference between the two vaccines we use.
Now, if you take away just one thing today, let it be this slide. For kids, we use a live attenuated vaccine, which is given as a nasal spray. For adults and at-risk groups, we use an inactivated vaccine, which is an injection. This isn't just about a needle versus a spray. We're talking about two totally different vaccine technologies. And that right there is why their indications and, more importantly, their contraindications are worlds apart.
Okay, keeping that core difference in mind, let's really dig into that first pathway. Section 3 is all about the kids, the pediatric pathway, and that live intranasal vaccine.
The kids program is actually pretty straightforward. It's a simple nasal spray, which is great. It all starts when a child is about 2 or 3 years old, and then they get it every year after that. And here's a really key point, especially when you're talking to parents. For this age group, this live vaccine is actually more effective than the injectable one.
Here's a super important detail for your practice. What if you have a child who's never ever had a flu vaccine before? Well, for these vaccine-naive kids, specifically between 2 and 9 years old, one dose isn't going to cut it. They need a second dose to really build up a strong immune response.
I get this question a lot. What about kids who are already in an at-risk group, say a child with asthma? The protocol here is really clear. They get the standard live intranasal vaccine just like everyone else. The only time you do something different is if they have a specific contraindication. In that case, you'd fall back on the inactivated injectable vaccine as the alternative.
Now, because this is a live vaccine, we have to be really careful about the contraindications. You absolutely cannot give it to a child who's immunocompromised or to any child under 2 years old. You'll also want to wait if they have a fever or a really blocked nose that would stop the vaccine from being absorbed properly. And this is a big one. If a child is currently wheezing or has a history of severe asthma, we're talking BTS step 4 or higher, they are not a candidate for this live vaccine.
The list continues. A confirmed egg allergy is a contraindication, and it's not recommended for those who are pregnant or breastfeeding. But listen up, this last point is critically important. If a child is on aspirin long-term, maybe for something like Kawasaki disease, the live flu vaccine is an absolute no-go. This is because of the risk of triggering Ray's syndrome, a rare but very serious condition. This is a massive safety point. So, what should parents expect afterwards? Well, the side effects are usually pretty mild. It's good to let them know their child might get a blocked or runny nose, maybe a bit of a headache, or just not be that hungry for a little while. These are all common expected reactions.
Okay, time to switch gears. We've got the pediatric pathway down. Let's move on to Section 4, the adult pathway, which is all about that inactivated injectable vaccine.
So the technology here is completely different. The adult vaccines are inactivated, meaning they're not live. They're typically trivalent, which just means they're designed to protect against 3 different strains of the virus, 2 influenza A types and 1 influenza B type, all based on predictions for the upcoming season.
So, who actually gets this vaccine? Well, the eligibility list is long. It starts with a simple rule: everyone over 65. Then you add in a whole host of chronic conditions. We're talking respiratory, heart, kidney, liver, and neurological diseases like stroke or TIA. And a really key one: this includes all patients with diabetes, even if they're just diet-controlled.
And that's not all. The list keeps going. We also vaccinate anyone who is immunosuppressed, anyone with asplenia, and pregnant women at any point in their pregnancy. It also extends to adults with a BMI of 40 or higher, all frontline health and social care staff, people in long-stay care homes, and even the unpaid carers who look after vulnerable people. It's a really broad, comprehensive strategy.
And that brings us to our final section. This is where we pull it all together. Let's run through some essential clinical pearls. These are those high-yield facts that are perfect for when you need a quick answer in the clinic or for your exams.
Let's talk numbers. For adults, the vaccine is about 75% effective. It's worth remembering, though, that this number does drop a bit in the elderly. And here's a crucial piece of info to share with your patients. It takes about 10 to 14 days after the shot for their body to build up enough antibodies to be protected.
This table is a fantastic little summary of the practical stuff. The most important thing for reassuring patients is that this is an inactivated vaccine. It cannot give them the flu. That mild fever or feeling a bit off for a day or two, that's just their immune system firing up. For the practice managers out there, remember, it lives in the fridge between 2.5 degrees and away from light. And you'll notice the contraindication list is much shorter than for the kids' vaccine. The main one is a known hypersensitivity to egg protein.
So, at the end of the day, it really all boils down to this. Effective flu prevention is about picking the right vaccine for the right patient. You have to look at their age and their clinical status and then choose the correct pathway. That's the secret sauce. And that leaves us with one final thought to chew on. We have these 2 very different vaccine technologies, one using a live virus, one using an inactivated one, both aiming for the same goal. It really makes you wonder, doesn't it? What's the next frontier for flu prevention? What will that next generation of vaccines look like?